Hello, myself Dr. Reshma Patil, Associate Professor in Department of Community Medicine, Symbiosis Medical College for Women, Pune. In this online course on COVID-19 care for community, would like to discuss with you the safer ways to celebrate events and holidays. India is a land of festivals and fairs, and we the Indians always want a reason for celebration, whether it is festival, birthdays or holidays. There are many festivals celebrated in India than anywhere else in the world. But the fear of COVID has taken the joy out of festivities since last 1 year. As we all know, in the current situation of COVID-19, holidays, gatherings and celebration of festivals with relatives and friends have changed, as there are lot of restrictions on our activities. It has been stressful for everyone, adults and children alike. So, it is important to keep celebrating and getting together in creative ways. The reality is that hosting large parties, traveling to see friends and family, and brushing off masks and social distancing can have serious consequences that extend far outside of your own circle. The majority of COVID-19 cases may result of asymptomatic or pre-symptomatic transmission. So, there will be a question in your mind whether to celebrate our festivals or not. The answer for this is, of course, we can celebrate, but with some modifications. You can still make the most out of the most wonderful time of the year. Also, special celebration times can help us ease pandemic fatigue by reconnecting safely with family and friends. Let us see some ways to enjoy holidays and gatherings while keeping the people you care about safe and happy. In the current situation, the safest option for now is to celebrate holidays and other special events only with members of your own household. To connect with friends and loved ones you cannot see in person, so host virtual events. During these virtual events, you can chat while eating, play games, see each other's holiday decorations or share recipes, and also can organize recipe competitions. Weddings, funerals, graduations and other major milestones can be shared virtually, letting lots of people join from near and far. Children, one of the important group of our society, should not be neglected in this pandemic. These virtual parties can become very much memorable for your kids by making gifts for each other or letting kids write letters to each other and loved ones. Older children and teens can have fun by inviting friends to play games virtually. Kids can be involved in the creative process of making video holiday greetings and invitations, from writing a script to filming to emailing others. You can play games of your childhood with involving your kids or have a virtual game night with friends or your family. This is about enjoying virtual parties. But some people or families may choose to gather with people they don't live with, and this is more of a risk than gathering virtually or gathering with people from your own household. Therefore, try to follow some rules like have an outdoor celebration that offers fresh air. Limit the number of guests so that people from different households can stay at least 6 feet apart. You can set up chairs or tables in advance, so people know where to be safely. If you are celebrating indoors, open windows to increase the ventilation. You can inform people to bring their own food and drinks to limit touching the same surfaces. If you do share food, have one person serve the food while wearing a mask, so only one person touches the serving spoon. Everyone 2 years and older should wear a mask except while eating and drinking. Wearing of mask with proper technique is important, and also following the social distancing while outdoors. I will show you what is the right technique. Let us watch this video. Now, you must have understood how to wear the mask properly. Due to work pattern or during holidays, you may have to travel a distance. Each type of travel will come with its own varying degree of risk, but being in close proximity to other travelers does increases your chance of getting or spreading COVID-19 infection. If possible, road tripping may be your best option, but be aware that making stops for food, gas or petrol or bathroom breaks will increase your risk. Before starting, be sure to check local and state guidelines and travel advisories, since many states are implementing travel restrictions and urging people to stay home this holiday season. Another important recommendation is try to delay your travel till you get fully vaccinated and strictly maintain COVID appropriate behavior while traveling. If you are planning to travel out of your local area for the holidays, follow the certain instructions for staying safe, like as much as possible avoid crowds and indoor places that do not offer fresh air from the outdoors. Wear mask in public transportation or in public places such as aeroplanes, trains, taxis, in gas stations and inside airports or train stations. The mask with 2 or more layers will be useful to stop the spread of COVID-19 and protect others as well as yourself. Make sure it fits snugly over your nose and mouth. Secure it under your chin against the sides of your face. The mask should be used indoors as well as outdoors. During traveling, avoid close contact and stay at least 6 feet apart from anyone not from your household. Wash hands often and thoroughly means wash hands with soap and water for at least 20 seconds, especially after blowing your nose, coughing, sneezing and before eating. If soap and water is not available, use a hand sanitizer that contains at least 60% alcohol. Always keep extra hand sanitizer with you in travel. Now we will watch the steps for hand washing.
Hand washing is one of the most important ways you can keep from getting sick and spreading germs to others. Dirty hands spread disease. This hand washing demonstration will show you how hand washing can get rid of germs and chemicals that get on our hands every day. This gel is like the germs and chemicals that we get from things we touch throughout the day, like our toys and pets. If we then rub our eyes, nose, or mouth, or pick up something to eat, the germs or chemicals can get into our bodies and make us sick. Studies have shown that people touch their eyes, nose, and mouth about 25 times every hour without even realizing it. To get rid of these germs and chemicals, CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water. Turn off the tap and apply soap. Then, lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. If you don't have a clock nearby, keep scrubbing until you've sung the happy birthday song twice. Rinse your hands well under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dry them. Washing your hands using the steps we just demonstrated is very important to get hands completely clean. Let's see how well we got rid of the germs and chemicals. Great! No more germs and chemicals. Why is this so important? Germs and chemicals from unwashed hands can get into our foods and drinks when they're being prepared or when we're eating or drinking them, which can make us sick. Also, germs and chemicals from unwashed hands can be transferred to other objects like cell phones, tabletops, or toys, and then transferred to other people's hands. That's why it's so important to wash your hands following these steps. Wet, lather, scrub, rinse, and dry, so you can stay healthy and help keep those around you healthy.
Always follow these steps for washing hands whether there is a pandemic or not. Coming to the other important guidelines for traveling. These are: avoid repeated touching to your mask, eyes, nose and mouth. Keep an eye on the number of cases in your home city and your travel destination. The more cases in either location, the higher your risk of catching or spreading the virus. Research your destination's requirement and restriction for travel. Many states have differing guidelines and may require you to quarantine for up to 14 days after arrival. Always keep in mind that people without symptoms or with a recent negative test result can still spread COVID-19 to others. Even when you take every precaution, it is important to know when you should cancel a trip. If you start to feel sick or if you have been around someone who is sick, reconsider your plans. During pandemic, your duty is not getting over, even after travel. So after travel, again you have to follow some rules. First important is self-monitor for COVID-19 symptoms. Isolate and get tested if you develop symptoms. There are few recommendations on travel for unvaccinated people also. If you are not fully vaccinated and must travel, take the following steps to protect yourself and others also from COVID-19. So before travel, get tested with a viral test, that is RT-PCR, 1 to 3 days before your trip. While you are traveling, wear mask and maintain physical distance. Avoid crowds and stay at least 6 feet or 2 meters from anyone who is not traveling with you. Wash your hands often or use hand sanitizer. And after travel, get a viral test, that is RT-PCR, 3 to 5 days after your travel, and stay home and self-quarantine for a full 7 days. Even if your test is negative, stay home and self-quarantine for 7 full days. If your test is positive, isolate yourself to protect others from getting infected. If you don't get tested, stay home and self-quarantine for 10 days after travel. Avoid being around people who are at increased risk for severe illness for 14 days, whether you are tested or not. We all know that since last few months, vaccine is available in our country. So, get vaccinated as early as possible to protect ourselves. Once all get vaccinated, you may be able to start doing things that you had stopped doing because of the pandemic. For example, you can gather indoors without masks with other people who are fully vaccinated. Although vaccine is available, we are still learning how vaccine will affect the spread of COVID-19. So, until we know more about how vaccine will affect the spread of COVID-19, people who are fully vaccinated against COVID-19 should keep taking precautions in public places like wearing of mask, staying 6 feet apart from others, avoiding crowds and poorly ventilated places, and also the washing of your hands. There are still some guiding principles for fully vaccinated people. Indoor and outdoor activities pose minimal risk to fully vaccinated people. These people have reduced risk of transmitting COVID-19 to unvaccinated people. But if they experienced symptoms of COVID-19, they should get tested immediately. And if they have tested positive for COVID-19, should not visit to any private or public setting. Now, let us see what precautions to be taken while we are hosting any gathering. If you are sick or have been near someone who thinks they may have or have been exposed to COVID-19, cancel the gathering. During gatherings, encourage social distancing. Try to host your gathering outdoors whenever possible. If this is not feasible, make sure the room or space is well ventilated by opening the windows. You can arrange tables and chairs to allow for social distancing. People from the same household can be in groups together and can sit 6 feet away from other families. If planning for some activities like games for adults and or kids, consider those where the social distancing can be maintained, like sidewalk, chalk art or frisbee. Try to limit the number of guests for gathering in current situation. When guests arrive, minimize gestures that promote close contact. For example, not to shake hands, do only elbow bumps, or best is our Indian gesture, that is Namaste. So now we will watch these simple gestures.
You can help stop the spread of germs and viruses, including the coronavirus, by switching up just one thing: the traditional handshake. Try these alternatives instead: the elbow bump, the foot tap, the head nod, the yoga bow, or just simply wave. Show us your moves.
Thus, COVID has made whole world to make changes in routine habits of shaking hands. Another recommendation is wear mask when less than 6 feet apart from people or indoors. Make masks available for your guests and encourage everyone to wear them. Limit the number of people handling or serving the food. Encourage guests to bring their own food and drinks. Limit people going in and out of the areas where food is being prepared or handled, such as in the kitchen if possible. While serving any food, identify one person to serve all food so that multiple people are not handling the serving utensils. Use single options, that is, disposable items like plates and utensils for meals. In addition to this, you need to take more precautions nowadays, like during gatherings, clean frequently touched surfaces and items between the use and even after gatherings. Identify a separate space for guests to wash their hands or provide hand sanitizer to them. Remind invited guests to stay home if they have been exposed to COVID-19 in the last 14 days or are having COVID-19 symptoms. Anyone who has had close contact with a person who has COVID-19 should also stay home and monitor their health. Consider keeping a list of guests who attended the gatherings for potential future contact tracing needs. After the celebration, again our duty is not getting over. After the event, whether you have hosted or attended, if you may have been exposed to COVID-19 or have COVID-19 symptoms and have not been fully vaccinated, get tested for COVID-19, that is RT-PCR test. While you are waiting for the results of COVID-19 test, stay at home and follow safety measures. Follow guidelines and stay at home for 10 days if you test positive. If your test is negative, you need to stay home for 7 days. If you are fully vaccinated and were exposed to COVID-19 virus at the event, you don't need to stay away from others or get tested unless you have symptoms. If you develop symptoms of COVID-19 or your test is positive, you need to take a very important step in the form of contact immediately to the host and other guests who attended the event, which is known as a contact tracing. This can help reduce the spread of COVID-19 by ensuring that others get tested or stay home and away from others if needed. Now, we will watch a small video on how to clean home after celebration or if someone recovers from COVID-19 in your family.
To date, a case has not been documented in which the coronavirus has been transmitted to humans from surfaces contaminated with the virus. Still, the Centers for Disease Control and Prevention recommends that frequently touched surfaces in your house should be routinely cleaned and disinfected to lessen the chances of transmission. But how exactly should you disinfect all the surfaces in your home? First off, be sure to read the labels of your products to ensure correct usage and safety. Use EPA-approved disinfectants, and it's best to use disposable gloves. If using reusable gloves, be sure to use them only while cleaning and disinfecting for the coronavirus. Always wash your hands immediately after taking the gloves off. Focus on cleaning and disinfecting the most frequently touched surfaces in your home. Think tables, doorknobs, handles, light switches, desks, toilets, faucets, sinks, and electronics. When it comes to electronics, research suggests that the virus can last a long time on these types of surfaces. For non-porous surfaces like a keyboard or a phone, research from the National Institutes of Health, CDC, Princeton University, and UCLA says that the virus could live on them for 2 to 3 days. The CDC suggests removing any visible contaminant if possible. To disinfect, you should follow the instructions from the manufacturer. Apple recently updated its guidelines for disinfecting its products. To clean your iPhone, you can clean it with a damp lens cloth and then gently wipe it with a Clorox disinfecting wipe, while avoiding getting any moisture in any of the openings. You can also use the wipes on your other Apple products, such as your laptop. If your electronics manufacturer doesn't provide disinfecting instructions, the CDC suggests using alcohol wipes or sprays with at least 70% alcohol for touchscreens, and all surfaces should be thoroughly dried to avoid any pools of liquid forming. For hard surfaces, the coronavirus appears to last the longest on plastic and stainless steel, about 2 to 3 days. If your surfaces are dirty, be sure to first clean them with a detergent or soap and water before you disinfect. You can then use an EPA-approved disinfectant on the surface. Diluted household bleach solutions are an option, but make sure to follow the manufacturer's instructions for application. Make sure it's not expired, and never mix household bleach with ammonia or any other cleanser. Make sure to open a window so you get plenty of ventilation while and after applying the bleach. To make a bleach solution, mix 5 tablespoons of bleach per gallon of water or 4 teaspoons of bleach per quart of water. For soft surfaces such as carpeted floor, rugs, and drapes, first wipe off any dirt or contaminants you can see. Then use an approved cleaner while following the cleaner's manufacturer instructions. If possible, put the items in the laundry according to their manufacturer instructions using the warmest appropriate water setting. Be sure to dry thoroughly. Dirty laundry from an ill person can be washed with other people's items, but if you need to handle laundry for someone who is sick, use disposable gloves or gloves that are dedicated to cleaning and disinfecting for the coronavirus. Do not shake dirty laundry. This will minimize the possibility of dispersing the virus through the air. Use the warmest water setting appropriate for your items and make sure they're dried thoroughly. Also, be sure to clean and disinfect your hamper. If possible, you should use liners that are disposable or washable. And finally, clean your hands immediately after using the gloves. If you don't use gloves, be sure to just wash your hands immediately after handling the laundry. Make sure you follow the CDC's additional home care guidelines on its website when caring for a sick person. If possible, allow a person to clean and disinfect their own bedroom and bathroom. And just a reminder, cleaning surfaces is not a substitute for washing hands. Experts say washing your hands with soap and water and avoiding touching your face are still the best ways to avoid contracting the virus. So, at the very least, keep washing those hands.
I think it must be clear to you how to disinfect your home. While celebrating, we should not forget the important vulnerable group from our family and community. So, which is this group? These are the high-risk members who are more likely to become severely ill than others because of their older age, some underlying medical condition from which they are suffering, or due to pregnancy. Here, the meaning of severely ill is that due to COVID-19, these high-risk members may need hospitalization, intensive care, or a ventilator support to help them breathe. While children have been less affected by COVID-19 compared to adults, children can be infected with the virus that causes COVID-19, and some children may develop severe illness. So, the children with underlying medical conditions are at increased risk for severe illness compared to children without underlying medical conditions. If we check age-wise, people at the age of 60s or 70s are in general at higher risk for severe illness than people in their 50s and below. The greatest risk for severe illness from COVID-19 is among those aged 85 or older. Older people can be helped to feel positive if they engage with the world and stay active. Don't lock them up and try to protect them. Make sure they are not immobile for longer period of time, watching television for longer periods, or remaining bedbound. The another high risk group is people with some medical condition or disabilities and pregnant women. They are more likely to get COVID-19 and have worse outcome. These medical conditions basically includes cancer, chronic kidney disease, chronic lung diseases, dementia or other neurological conditions, diabetes mellitus, whether it is type 1 or type 2, Down syndrome, heart conditions, HIV infection and pregnancy, etc. Being a current or former cigarette smoker or dunker can make you more likely to get severely ill from COVID-19. Such medical conditions or treatment of it can weaken your body's ability to fight off the disease. If you have medical condition, the following are actions you can take based on your medical condition and other risk factors. So, watch for the symptoms and emergency warning signs. Pay attention for potential COVID-19 symptoms like fever, cough, shortness of breath. If you develop any emergency warning signs for COVID-19, get medical attention immediately. In adults, the emergency warning signs includes difficulty in breathing or shortness of breath, persistent pain or pressure in the chest, confusion or inability to arouse, bluish lips or face. There might be some other symptoms also. So, to get clarified, please consult your doctor. It is important for people with medical conditions and their providers to work together and manage these conditions carefully and safely. Thus, as older adults, people with underlying medical conditions and pregnant women are more vulnerable to coronavirus complications, it is important to do your part to especially limit exposure to these individuals. Now, there are few do's and don'ts for high-risk people need to follow to protect themselves. Let us see what are the do's. So, keep in touch with family and friends through phone, internet and social media. Use telephone or online services for other essential services, drug delivery, banking, grocery delivery, etc. So, you can avoid going out for these things during pandemic. Wash hands often with soap and water for at least 20 seconds, especially after blowing your nose, coughing or sneezing, or having been in public place. If soap and water not available, use alcohol. Use alcohol-based hand sanitizer. They should follow respiratory etiquettes, that is, use a tissue or your sleeve to cover your mouth while coughing or sneezing, and wash your hands or sanitize them after throwing the tissue in a closed bin. Avoid touching surfaces in public places like elevator or lift buttons, door handles, handrails. Use a tissue or your sleeve to cover your hand or finger if you must touch something. Maintain at least 1 meter distance with everyone. Contact the doctor to ask about obtaining extra necessary medicines to have at home in case of an outbreak of COVID-19 in your community, and stay home for a prolonged period of time. Have enough household items and groceries on hand to be prepared to stay at home for a considerable period of time. Clean and disinfect home to remove germs and any triggers for your illness. Practice routine cleaning of frequently touched surfaces like table, doorknobs, light switches, desks, faucets, sinks and cell phones using available disinfectants. High-risk people should follow certain things strictly, or you can say there are few don'ts for them like do not touch eyes, nose and mouth with unclean and unwashed hands. Do not travel if not necessary or essential. Do not go to the hospital for routine health checkups and use telephone to contact the doctor. Do not come in close contact with those who are sick or not well. Do not go for gatherings with friends and family and stay away from large gatherings. High-risk people need to take preventive measures for COVID-19 such as complete vaccination, wearing of mask, social distancing and practicing hand hygiene. They should keep themselves busy to take care of their own mental health, especially during the current pandemic, and most important, getting information from authentic sources. Here, we will watch a small video how to take care of mental health during pandemic for all age groups.
Oh.
In addition to this, also they should keep themselves well hydrated, exercise and eat right as a routine practice. They should continue medicines and do not change the treatment plan without talking to your doctor. Follow current treatment plan to keep your medical conditions under control. For example, asthma action plan, dialysis schedule, blood sugar testing, nutrition or exercise recommendations that are given by your doctor or suggested by your doctor. Thus, celebration needs extra planning during the pandemic, but taking safety precautions can allow you and your family and friends to celebrate and minimize the risk of becoming infected with or spreading the COVID-19 virus. At the end, I would like to say that if you follow these simple guidelines for preventing COVID-19, you will be able to enjoy holidays and celebration definitely like we used to celebrate before the pandemic. Here is a small video of the situation that we want. Now, let us check what you have understood till now. We'll solve some questions and you can think for the answers. So, here is the question 1 for you. Can someone who is infected spread coronavirus if they don't have symptoms? So, your time starts now. You can think for the answer. So, the answer for this question is the virus spreads most easily when an infected person has symptoms, but it also can spread before symptoms starts. It can take 2 to 14 days after someone is exposed to the virus for symptoms to show up. The closer you are to someone who is infected with coronavirus and the longer you are together, the higher your risk of also getting infected. Okay, now we will go to the next question. So, the second question is, I am attending a small gathering or an event such as wedding, a party or sport tournament. What precautions should I take to protect myself and others from getting infected with COVID-19? Think for the answer. Yes, correct. So, your answer is always check local regulations before ending the event. Stay at home if you are feeling unwell. Always comply with the following 3 basic preventive measures. Maintain at least 1 meter distance, that is social distancing. Wear mask. Cover a sneeze or cough with a tissue or bent elbow and immediately dispose of the tissue in a closed lid bin. Avoid touching eyes, nose and mouth repeatedly and wash your hands frequently. Next question. What should I do if anyone of my family member has symptoms of COVID-19? So, the answer for this question is call your doctor if there is a fever, cough, sore throat, belly pain, vomiting, diarrhea, rash, dizziness. So, these are the common symptoms of COVID-19 or just doesn't feel unwell. Just doesn't feel well. If your family member has been near someone with coronavirus or lived in or traveled to an area where lots of people have coronavirus, tell the doctor. So, in short, tell the complete history to the doctor. So, the doctor can decide whether he or she should get tested for the infection, can be treated at home or should come in for a visit or can have a video or telehealth visit. And if the doctor thinks your family member needs care right away, they will guide you on where to go. So, here is the next question for you. Are the symptoms of COVID-19 different in children than adults? Your time starts now. So, the answer is no. The symptoms of COVID-19 are similar in children and adults. However, children with confirmed COVID-19 have generally shown mild symptoms. Reported symptoms in children include cold-like symptoms such as fever, runny nose, and cough. Vomiting and diarrhea have also been reported. It is not known yet whether some children may be at higher risk for severe illness, for example, children with underlying medical conditions and special healthcare needs. There is much more to be learned about how the disease impacts children. Coming to the next question. In-person events, who should avoid them? Your time starts now. So answer is, don't host or attend an in-person events if you or anyone in your household has been diagnosed with COVID-19 and has not met the criteria for when it is safe to be around others. If you have any symptoms of COVID-19 and if you are waiting for the results of COVID-19 test, or you may have been exposed to someone with COVID-19 in the last 14 days and has not been fully vaccinated, or if there is an increased risk of severe illness with COVID-19 and has not been fully vaccinated, or if you or someone you live with or work with is at increased risk of severe illness with COVID-19 and you are not fully vaccinated, avoid in-person events with people outside of your household. So like this, you should try to avoid the in-person events. This is the next question. If I decide to go out, are outdoor activities safer than the indoor activities? Your time starts now. Yes, so the correct answer is the virus that causes COVID-19 is mostly spread through tiny droplets when people who are infected breathe, speak, cough, or sneeze. Some people who are infected do not feel sick, but they can still spread the virus. While there is always some amount of risk when meeting people you do not live with, indoor spaces are more risk than outdoor spaces. It is harder to stay apart indoors and there is less airflow. Even when outdoors, remember to always wear a face covering to protect yourself and others and maintain at least 6 feet or 2 meters of space between you and others. The next question is, how should I clean and disinfect my home in order to protect myself and my family from COVID-19? You can think for this answer. The correct answer is, if you think a surface may be infected, clean it with simple disinfectant to kill the virus and protect yourself and others. If surfaces are dirty, clean them using detergent or soap and water before you disinfect. After cleaning and disinfecting, clean your hands with an alcohol-based hand sanitizer or wash them with soap and water. Avoid touching to your eyes, mouth or nose. On the regular basis, clean and disinfect frequently touched surfaces such as tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets and sinks and many other things. So like this, you should always disinfect your home, especially during the COVID-19. Coming to the next question. What does it mean to practice social distancing? So your time starts now. Okay, so the answer is keeping your distance from others, that is 3 to 6 feet or 1 to 2 meters away. Not taking public transportation, taxis or ride shares during this. Avoiding crowded places, for example, shopping centers, schools, workplaces, movie theaters and places of worship such as churches, temples, synagogues and mosques. Now, coming to the next question, which is in the form of a multiple choice question. In which of the following people COVID-19 is more dangerous? There might be more than one correct answer, so select all correct responses. So your options are children, older people, especially those aged 70 and above, people with certain underlying health conditions, European people. So think for the answer. Yes, so correct answer is older people and people with some underlying health condition. Most people's immune system will be able to fight virus and so COVID-19 won't make them seriously ill. However, it can be more dangerous for older people and people with existing health problems. COVID-19 is normally not serious in children and doesn't affect people differently depending on where they live in the world. Another multiple choice question for you is, what are the precautions that need to be taken to protect from the coronavirus? So choose a correct option. Your options are A. Cover your nose and mouth when sneezing. B. Add more garlic into your diet. C. Visit your doctor for antibiotic treatment. And D. As wash your hands after every hour. So think for the answer. So correct answer is yes, A. According to WHO, a person can take precautions by covering the nose and mouth while sneezing via tissue or an elbow. Then immediately throw the tissue into a closed dustbin. So these were the questions for you. I hope that you must have understood and you must have given the correct answers for it. Now, we will just revise the 7 important steps need to follow during the COVID pandemic. This is all about safety precautions during pandemic while celebrating festivals or enjoying holidays. I hope you must have got ample knowledge regarding this topic. Thank you very much. Stay safe and stay happy.